In this discussion, we're going to look at health appraisal and fitness assessment. So what we're going to be looking at is different assessment procedures and items that we want to have in place when we're kind of evaluating an individual who is getting ready to kind of undertake a physical activity regimen. We're going to look at different types of screening tools, and again, the idea is to approach this from a couple different perspectives. One is to make sure that the exercise they're going to be doing is going to be safe for them, that we have a full, complete background of in their medical background, and we want to make sure that we're kind of meeting the goals of the individual. So we all know that, for instance, everybody kind of benefits from having kind of a complete, well-rounded plan. But there may be certain areas where an individual may be more deficient that they need to work on, and we could address that through these various types of assessments. So first we want to look at the pre-exercise appraisal. So before we get into any type of actual physical testing of the individual, we want to make sure we have a pretty complete background on the individual to make sure that what they're going to be doing is safe, and if any other type of further medical clearance is necessary. And that's going to be a really important part of this. So say, for instance, maybe someone hasn't seen a doctor for some things they've been experiencing. This could be a point where maybe something is identified and then it gets recommended for them to get physician clearance prior to doing this. So basically the pre-participation screening via various questionnaires that we're going to be talking about, and just through general interviewing, kind of gives information on the individual's health history, kind of allows you to put together or allows the design of a safe and effective program for the client, because again, you want to make sure that you're doing something that isn't going to cause them any further harm. We want this obviously to be a benefit. And again, information taken from this will allow individuals to decide whether further medical clearance is necessary before they begin the exercise program. So, and it also kind of allows information on potential safety issues and medications and things like that the person may currently already be experiencing. So it kind of allows to kind of paint a full picture and see if there's any further evaluation necessary. So there's various documents that kind of facilitate this interview or screening process. You have the physical activity readiness questionnaire for everyone, or we call the PAR-Q+. And again, this is just a basic self-report of assessment of signs and symptoms of disease. So it's a very cost-effective, very easy thing to administer. However, further screening might still be required to determine the appropriateness of submaximal or maximal exercise and whether they could and what could be included in their program. So it's an excellent initial screening tool. However, it doesn't necessarily identify all the individual's specific medical and health concerns. So you usually need further evaluation. So this is a really good just kind of initial screening, and then there's other things you could add on top of that. The medical history questionnaire is a little bit more of a detailed assessment of their health history. So this goes through existing diagnosed pathologies, any orthopedic conditions they have, any recent surgeries, current medications that they may be on. Sometimes it should be noted that there are sometimes two separate questionnaires that look at both medical and health related issues. It just kind of depends upon the work setting that an individual's in. So between the physical activity readiness questionnaire and the medical history questionnaire, it will give someone a pretty good idea as to whether or not the individual needs further screening by a physician. And again, if there's any doubt, obviously you want to make sure that that they get further clearance. But this gives a good overall background on the individual as to whether what the individual will be prepared for in their individual programming. You have an informed consent form. So what the informed consent form does is it documents for the client exactly what's going to get done during any type of fitness testing, what risks are involved, and it also serves as a written record that the client has been informed of this. So this is kind of a legal thing that the client is made completely aware of what they're going to partake in, what are some of the risks, what are some things that they may experience, even if they don't have a known health condition that they know of. There are still some things that, you know, sometimes when you partake in physical activity, there may be some things that kind of come out as a part of that. So it kind of basically is education for the client, but at the same thing, it's also protection for the individual administering the test, because again, obviously people have to give their consent regardless. I mean, even in medicine, you have to give consent to be treated, you know, before somebody can actually treat you for something. And this kind of covers that aspect. Then you have the medical clearance form. You know, the medical clearance procedure allows the exercise professional, you know, in cooperation with a medical professional, to determine if there's any restrictions that should be placed on the participant. You know, for instance, an individual with chest pain shouldn't be permitted to participate in physical activity unless, you know, medical clearance has been procured. Once this is completed, then you can, you know, prescribe, you know, within medical parameters, and we'll talk about the different types of, you know, intensity guidelines and what have you, but that's what the medical clearance does. So all of these forms, and again, I encourage you, and we're going to work with them a little bit in lab. You know, they're all throughout Chapter 2. You can go through them, figures 2.1 all the way through figures 2.4 in the chapter. Illustrate these. So again, take a look at these, you know, kind of look at the differences, what's in them. But these are all tools that, again, they protect both the professional and the client. Okay, so this is kind of protection for both. It's protection for the client to make sure that, again, everyone's done their due diligence and we all kind of know the individual's background. And it's protection for the exercise professional. You know, the client has to be made aware, you know, particularly like, for instance, with the informed consent, it makes the client aware that, you know, even if they at the time seem healthy, you know, there could be still some, you know, discomfort that they may experience or some issues as a part of the testing. And they could also refuse to do it as well. Obviously, you know, if they're healthy enough to do it, we obviously don't want that to happen, but it also gives them the right of refusal, because obviously they don't have to do it if they don't feel it's something they feel comfortable with doing. So the guidelines for medical clearance, again, so physically active patients who do not exhibit known disease or signs and symptoms are not required to seek medical clearance and may continue with moderate to vigorous intensity training and may increase intensity as tolerated. Physically inactive clients without disease or signs of disease may start exercise training with light to moderate intensity without exercise progressing intensity as tolerated. So again, it kind of depends on, so if you already have somebody who's physically active, they don't exhibit any signs and symptoms. So these are just, again, some general guidelines that we're looking at. If it's somebody who's been doing exercise, or you know, they may work even a very physically active, you know, profession, they don't exhibit any known disease or signs, they could kind of get started and then obviously, you know, be educated as far as, like, you know, if you experience, you know, anything. Again, part of the education process is to let people know that anytime they have discomfort with exercise or with physical activity, that they need to kind of stop and possibly be evaluated. But in both of these instances, you kind of see where an individual can sort of start with as far as intensity of exercise based on their past experience. So further looking at guidelines for medical clearance, so clients who are physically active have a history of cardiovascular, metabolic, or renal disease. So, you know, cardiovascular disease, anything looking at, you know, cardiac, peripheral vascular disease, cerebrovascular disease. You know, metabolic disease would include type 1, type 2 diabetes, and any type of renal disease, so any type of disorders affecting the kidneys. But are asymptomatic are not required to receive medical clearance for moderate intensity exercise if they have received clearance in the previous 12-month period. So what we're basically looking at here is, and this was basically some of what we looked at on the previous slide, is looking at, okay, we kind of have these different tiers, if you will, or basic guidelines. So we looked on the previous slide just looking at their level of, are they active or are they inactive? Now we're looking, not only are they active, but do they have a history of disease? Okay, so if you have somebody who is physically inactive, they in generally will present a greater risk of, for instance, a cardiovascular event compared to somebody who already is active. And that's where kind of that first process looks at, are they someone who's active or are they inactive? Because again, if someone is doing regular physical activity, again, regular physical activity has been shown to be inversely related to a risk of serious cardiovascular event during or immediately following even intense exercise. Okay, so your relative risks of exercise-related cardiovascular events are known to be, remarkably greater from intense exercise than at rest, but they're also more related to, has the person been physically active or have they been inactive? So that's kind of the first thing you look at. Are they active? Are they inactive? Then you look at, well, now, do they have a history of any type of, again, cardiovascular, metabolic, renal disease, because that could all put them at risk for possible issues. So physically inactive clients with a known disease but who are asymptomatic should be referred to a medical professional for clearance prior to any exercise testing or training. Then after clearance, these individuals should begin with light to moderate intensity exercise. And again, we're going to define, again, for these special populations, what we would consider light, moderate, and vigorous intensity exercise as we kind of go through the discussion. Clients who develop new signs and symptoms should be referred for medical clearance regardless of training status or the presence of disease. So if in the process of going through and taking part in activity, an individual experiences new symptoms that they haven't had, then they should be referred. Okay, so again, if the person experiences any pain or discomfort in the arms, neck, chest, jaw, or other areas, because that could be indicative of angina or ischemia, okay, so possibly impaired coronary blood flow. They experience any shortness of breath during mild exertion or while rest, any dizziness or syncope, any orthopnea, ankle edema, heart palpitations, cramping in the lower legs, or what we call intermittent claudication, okay, that would be a cramping in the legs. If they experience, if any heart murmurs develop, any unusual fatigue, any unusual signs and symptoms that would develop during, while partaking in exercise, they then should stop and then get medical clearance or possibly look at to look at either the presence of disease or to see why the symptoms are occurring. So again, if a client is presently engaged in an exercise program, it must be discontinued and medical clearance should be obtained before recommending any exercise after clearance. Inactive clients displaying symptoms of disease should initiate exercise at light to moderate intensity levels and progress as tolerated. So if you're given an example of a client, for instance, so this would be something you'd want to be thinking about. If I gave you an example of a client, went through their history, you should be able to look at their history and determine, whether or not, one, they would, whether they would need medical clearance, and two, what intensity level, whether they need it or don't need it, they should possibly start their activity at when they're prepared to, or when they're going to be undertaking the fitness routine or the physical activity routine. So here we have our various parameters for exercise intensity, okay? So again, for what's considered light intensity exercise, 30% to a little less than 40% of their VO2 max or heart rate reserve would be considered light intensity exercise, exercise at around 2 to a little less than 3 metabolic equivalents. You'd want them to have a 9 to 11 on the rating of perceived exertion. So that's on the 6 to 20 Borg scale. So we've talked about the Borg scale before. So this is that where a person kind of puts a number, if you will, on their rating of perceived exertion. So, light intensity exercise, someone would rate somewhere to a 9 to 11 on that 6 to 20 point Borg scale. And again, the intensity should obviously produce a slight increase in heart rate and respiration rate. So you are going to have that. I mean, again, for the body to experience change, if you will, or to have to adapt to exercise, you do have to obviously bring the body above, a certain level of intensity. So it will produce a slight increase in heart rate, but we'd obviously be looking at a much lower heart rate here for an individual partaking in this, what we would consider light intensity exercise. So for moderate intensity exercise, okay, so here again, we're just basically going to be sort of ramping up the parameters. So be looking at 40 to 60 to less than 60% of VO2 or heart rate reserve. Again, you could look at the various ways we've talked about in a previous class, how we kind of measure and how we kind of look at heart rate reserve and VO2 max. 3 to slightly less than 6 metabolic equivalents, 12 or 13 on the rating of perceived exertion scale. And again, here you're going to produce a noticeable increase in heart rate and respiration, obviously to kind of get to that specific intensity level that we're looking for. And again, you could use any one of these as kind of your measure. Again, you could kind of determine what you would feel would be most comfortable for you and easiest to kind of educate the patient on for them to kind of moderate their intensity. And then here would be, again, for more vigorous intensity exercise, we're looking at greater than or equal to 60% upwards to 90% of VO2 or heart rate reserve, greater or equal to 6 metabolic equivalents, greater than or equal to rating of perceived exertion of 14 on the Borg scale. And here we're just looking at a substantial increase in heart rate and respiration rate. So this would be, again, for, pretty much most of the population, what you'd be looking at as an increase or what we'd consider high intensity exercise. So based on all of the parameters that I talked about earlier, so, you may even want to kind of pause this, go back, look at what we discussed previous to this, as far as, again, how we would assign this type of exercise based upon the parameters that I gave you previously, again, based upon whether we're looking at a physically active person versus an inactive person, and whether or not the physically active or inactive person has a known risk factor, particularly involving cardiovascular disease, metabolic disease, or renal disease, and then obviously be aware of all the signs and symptoms that I talked about, because, in those kind of 3 categories, if you will, those are all things that would show up, in a person maybe that we don't know is possibly or hasn't been diagnosed yet with any of those conditions. So again, further looking at, again, medical clearance issues. So again, even after medical clearance, medical supervision still might be recommended. So a medically supervised assessment and exercise program is recommended for high-risk individuals who have medically identified participation restrictions related to assessment tests, exercise programming, or both. So in other words, individuals such as this may have to, if they're really deemed high risk, they may have to have a fully medically supervised assessment and exercise program in a what we'd call a controlled clinical setting. So in other words, they'd have to undertake this in a medical facility that could offer immediate medical emergency care if something were to happen. So for some individuals, based upon, again, what you're seeing, they may not be able to undertake either assessment or their actual fitness routine in a non-medical setting, just because the risk of something happening possibly being too high. So it's very important that should happen. So again, they may have to be having their programming undertaken by somebody who is a healthcare professional with background in assessment and exercise programming. So if medical supervision isn't necessary, professional supervision may be prudent. So in other words, even if they don't need medical supervision, it may be important that they have supervised assessment and programming. So supervised assessment and programming is recommended for clients who have medically identified conditions or limitations, but are still allowed to participate in a fitness assessment or exercise program. So in other words, the assessment and programming needs to be overseen by a certified fitness professional who can assess, monitor, and modify the testing or exercise session when necessary. So again, for all of you in this class, again, everyone's going to, professionally have different levels and backgrounds in this. Some of you are going to fall under the category of a certified fitness professional, and you will, in this situation, you could still professionally supervise them. Some of you will have more background in the medical aspect and be a healthcare clinician, where there'll be further ability to kind of oversee somebody in certain work settings. So again, here we have another level of to what degree of supervision does the person need to have. So in this situation, if you have somebody who, obviously a lot of people tend to just exercise on their own and kind of do their own thing. It may be recommended that, for this individual, that they still have, professional supervision, at the very least, until we kind of see, where the person is at and how they kind of respond to the programming. Okay, so that takes us then to the assessment. So kind of once we get to the point where, we've kind of established that the person, is able to undertake a fitness assessment, we kind of determine where they need to do that, whether it's in a medical facility or in a non-medical facility. We look at the testing. So again, the rationale for testing includes, and again, these are some common things we would look as to reason why we would do testing. It kind of serves as kind of establishes a baseline to track progress. It allows us to identify current levels of fitness that will contribute to the exercise programs and establish appropriate exercise. So it kind of lets us see, where the person's strengths and weaknesses are. It allows us to select, it allows us to, for appropriate exercise selection, frequency of exercise, gives us appropriate intensity of exercise, volume of exercise. It also helps us develop short and long-term fitness goals. And again, it helps to identify any type of needs, limitations before they begin an exercise program. Establishes a method of recording things, so it allows us to kind of record various things and keep records on the individual. And it just allows us, in context, to provide decisions regarding appropriate scope of practice in case the client experiences an injury or an exacerbation of a current medical or health condition after the program begins. So it kind of allows all of this to, to kind of take place so that we can, kind of oversee what the person's going to do. So some thorough testing just allows us to kind of manage the program, create the program, allows us to kind of go back if the person does experience an issue while they're taking part in the exercise program, or if maybe they have to stop exercise for a while, we could kind of get to go back if we're still working with the same person and assess where they were at. So fitness testing results need to be put in context in order to provide guidance for goal setting and progression. So again, it's important that we, are able to kind of assess where an individual is at, and kind of allows us to provide where we could kind of go have they reached goals, what should their goals be, and kind of how to progress the person. And properly standardized tests will give results that can allow clients to be compared to either their peers using a percentile rank or some established standard for health. So it kind of gives us different types of standards that we could sort of look at regarding where the person stands regarding peers, and regarding their specific health. So, standards for fitness assessment based on norm reference data are used to compare the fitness levels of like individuals on the same test. So we look at, gender, age, and so on. That's what norm reference data is used for. And those results are usually then reported then on the percentile rank. And, they give some examples of that in your textbook. Whereas criterion reference physical fitness tests have predetermined levels of acceptable minimal outcomes of performance. Okay, so they kind of give you some background on what the test will actually give you as far as looking at that relative to their health. So again, when you're looking at the criterion references, the criterion reference physical fitness test, they kind of will let you know like what you at least want as far as of a minimal outcome for performance. Okay, so it basically kind of does set a minimal standard. So if the results of a criterion reference test exceed minimal standard, then the client has successfully completed the test. So that's an important thing to note. So a criterion reference test will kind of give a standard for somebody, and then you get to see do they exceed it, or they or is it something that they need, further assistance on. So, I mean, currently there are no general physical fitness standards based on normative or criterion references for diseased or disabled populations. So it's really important for an exercise professional to establish, appropriate goals for clients whose baseline scores place them below average or well below average for healthy individuals. So you want to make sure that you're setting reasonable goals for those individuals. So again, regardless of any standards used, clients can still track their improvement by comparing their later scores to initial ones. So that's an important thing to kind of note, and that could help improve self-confidence and motivation. So that's another reason why you would look to do these tests, is to give the client something to kind of shoot for, if you will. In other words, it kind of will help their self-confidence. If they see that they could improve, that's something that you would want to take into consideration. And again, this is important regarding standards for disease and disabled individuals are lacking, and often reaching preset goals is the only source of tracking progress. So that's why I said, particularly, I'd mentioned this in the previous slide, with disease and disabled individuals, we don't necessarily have standards for them. So I had mentioned the whole criterion reference, fitness test. Well, for individuals who obviously have a pre-established disease or disability, we don't have as much data on, what should be their minimal standards. So this could be the only source of tracking. So in other words, as they're going through, an individual in a special population would have, this would be kind of their only reference point to say, well, am I improving, or do I still need to continue to work on certain aspects of, of physical fitness? So again, in disabled and diseased populations, it's really important to select appropriate fitness tests, and it's the exercise professional's job to recognize how a given condition may alter the standard assessment. So again, part of what this course is going to give you is some further background on different pathologies, so you would kind of know, what about a person's condition could possibly influence the test, and that may even require an alteration of possibly a standard assessment. For example, your book gives the example of a client who might have trouble walking. You might have to use an arm ergometer and not a treadmill for a certain cardiorespiratory assessment, and again that's going to impact your results. So that's something you're going to have to be aware of, and again, use everything as a baseline for the individual. I guess that's probably the easiest way to look at it, is if you're having to make a significant modification like that, you can still utilize your results to get information for that person. Additionally, a client's maturity level and chronological age may affect their test performance. So certain protocols may be appropriate for younger clients, but improper for older ones, okay? So for example, a treadmill test using the Bruce protocol may be considered appropriate for younger people, but that might need to be reduced in intensity for individuals who've known disease or for older people. So that's an important point to note. And again, similarly, appropriate tests must be selected based on gender-specific differences, okay? So again, gender-specific physiologic factors can affect assessment scores of a protocol and on some assessments. For instance, women generally have larger quantities of body fat and less muscle mass than men, and they tend to have smaller shoulder, hip and knee structure that supports less muscle mass. So again, when you look at some of these tests, you will see, for instance, for some of the strength-based tests, we're going to have different testing weights for men versus women, just because of that physiologic fact that we deal with when we're looking at both genders. So looking at our fitness assessment, we have to look at test order, particularly if we're going to be looking at multiple tests getting done within one session. And this is something that we have touched on before in other classes when we're looking at athletics, and a lot of similar ideas still take place here. So nothing really changes. You still want to do your assessment test. So in other words, you want to do all your non-fatiguing tests first. So in other words, measuring height, weight, resting heart rate, resting blood pressure, flexibility, body composition, anthropometric measurements, and neuromuscular assessments. Those are all things you want to do first. So all your non-fatiguing things. Then your tests of agility, if you're going to, if they're deemed appropriate for the person. Any maximal muscular strength tests would then be done after that. Local muscular endurance would be done after maximal strength, and cardiovascular endurance would be done last if all of them were getting done in one day. Again, the idea here is that you don't want a previous test to affect the latter one. And in that order, the way they're set up, that basically makes it so, in other words, if you did, for instance, a local muscular endurance test, say something for the upper body, and then you went and did a one rep max bench press, that would obviously affect the 1 rep max bench press. Whereas doing them in the other order, you'll have much less of an effect. So that's important to know. So again, when we're looking at, testing protocols, again, we're looking at tracking. We're looking at tracking a client's progress towards goals, and that's going to be, very important for, continuing to motivate the client as we're going through. So it's going to look at the efficacy of the training program. And again, the accuracy of your testing is going to depend on the ability for the exercise professional to select proper tests, properly explain them, the procedure of the test, and then prepare the client to complete the test and carry out the protocol successfully. So again, we're looking at, evaluating their fitness level, and kind of looking at, what their goals should be, and kind of making sure that the exercise program is going to be safe and basically achieve all their necessary goals. Okay, so we're going to look here at pre-assessment measurement procedures. I'm going to go through, again, all of the tests actually fairly quick through this discussion. So what I'd encourage you to do is, go through, your textbook has the procedures. I'm going to kind of point some things out, but, for the most part, I'm going to encourage you to still kind of go back even after this talk to look at your textbook and make sure you kind of get all the kind of little intricacies that you would need to know for this. So resting heart rate, pretty simple to measure. Ideally have the individual sit kind of quietly and comfortably for about 3 to 5 minutes. Palpate you're going to do this via the radial pulse, and you're going to use the tips of your index and middle finger. And your textbook recommends taking a full 60-second count. I tend to use 15 seconds and multiply it by 4. Certainly, obviously, you can do either method, whatever you would feel comfortable with. It's probably a good idea to either have a clock nearby, obviously, or a watch with a second hand to kind of be able to take your measurement. Resting blood pressure, you're obviously going to want to make sure that you have an appropriately sized sphygmomanometer to take the blood pressure with, because there are different sizes. Again, you want to make sure, so review the procedure as far as alignment of the blood pressure cuff. Essentially, once you have it on the person and the person positioned appropriately, you're then going to inflate the cuff fast to at least 160 millimeters of mercury or 20 millimeters of mercury above the known resting systolic blood pressure. So if the person, for instance, has a high blood pressure, you're going to want to make sure that you go at least 20 millimeters of mercury above that. You want to then release the air very slowly, about 2 to 3 millimeters of mercury per second. You're going to record the systolic blood pressure as the first audible, what we call Korsakoff sound. And then the diastolic pressure is once it disappears, that will be your diastolic number. They recommend recording them in even numbers to the nearest 2 millimeters of mercury. And again, what I would suggest is for you to review the blood pressure classifications for adults on table 2.1. So make note of that and make sure that you're aware of it. It'll be expected that you know those different measurements. For body weight, again, pretty simple. Have the client make sure they empty their pockets, remove shoes or any heavy articles of clothing. That's just going to give you the most accurate measurement. Make sure they're standing on a device that's stable, and will give you your appropriate measurement. For height, make sure they again remove their shoes. They stand with their feet together. And again, depending upon your measurement device, you'll measure the height as vertical distance from the floor to the top of the head. Again, various devices can be used for this to get your most accurate measurement. For lung function, basically you could test forced expiratory volume using a spirometer. This test can be used to determine the limitation in pulmonary flow rate. So just kind of review the procedure for using the spirometer. The specific spirometer, again, look at your specific instructions for the type of the one you have. Basically, the client is going to perform a forced expiratory maneuver, which requires maximal inhalation followed by the maximal exhalation, and that will give you your number, your forced expiratory volume. So for cardiovascular endurance tests, your cardiovascular endurance or your VO2 max is going to be assessed with some type of graded exercise test, but some clients could only reach a VO2 max peak, which might be limited by their particular disease. So that's something that you're going to kind of want to make sure of, that you're again aware of, and that's why we're doing our health history and medical clearances for an individual. So again, these individuals may kind of be limited and maybe just reach that peak VO2 just because they can't hit a true VO2 max. And again, additionally, some disease clients might not be adequately assessed using common protocols such as the Bruce protocol because there's such large jumps in intensity. So again, some of what you're going to be looking to do is you're going to have to determine which tests are important. There may be a particular test that you like to use, but it may not be appropriate for the person. So you want to make sure that the test protocol are appropriate. The test protocol you're going to use is going to be appropriate for the individual. Another disadvantage that we see with a lot of standard protocols is that the test cannot be individualized, so each client can complete the test in the 8 to 10 minutes of exercise time recommended for accurate assessment. So in other words, a person with chronic disease may have such low cardiovascular endurance capacity, they may just be unable to complete the test. So it's important to make sure that their approximate ability and kind of estimate peak exercise capacity, and just design the test to yield 3 or 4 changes in work rates during an 8 to 10 minute during an 8 to 10 minute test period. So fitness test procedures, again, continuing to look at cardiovascular endurance tests. We're going to look at test termination criteria. So when we know we want to stop any sort of testing, again, client reports any symptoms of chest pain or angina. Their systolic blood pressure drops more than 10 millimeters of mercury from baseline as their work rate increases. Any extreme increases in blood pressure. So again, any significant drops or increases in blood pressure, we obviously would want to make sure we terminate the test. If their systolic blood pressure is greater than 250 or their diastolic pressure goes above 115, would all be reasons to terminate testing. Further test termination criteria: shortness of breath, wheezing, leg cramps, any symptoms of claudication, which again is kind of cramping in the lower legs. That's just a sign of inadequate blood flow. So again, we're looking at some type of circulation issue then affecting the lower leg muscles. Any ataxia, dizziness, pallor, cyanosis, cold or clammy skin, nausea, or any other sign indicative of poor blood perfusion would cause the test to be terminated. and if the heart rate fails to increase with increased work rate. So as the work rate increases, the heart rate should go up with it. Obviously, that would be, an alarming sign if their heart rate, because then basically their cardiovascular system isn't maintaining itself and being able to keep up with the increase in demand. Other test termination criteria: heart rhythm changes. If the client asks to stop the test, so if they just perceive discomfort and don't want to continue on with testing, make sure you stop. They exhibit physical or verbal indication of severe fatigue, and testing equipment malfunction. So again, I want you to be aware of this list, but again, just from the standpoint of common sense, anything that would, raise alarm, certainly you would want to discontinue any type of testing that the person is undertaking, because again, you just run the risk of possible issues associated with it. So cardiovascular endurance testing guidelines. Again, heart rate and blood pressure should be taken immediately before the exercise test. And again, and ideally with the client in the same posture that will be used during the test. So again, because that kind of tells you where they're going to be at, that if you do have to take their blood pressure or their heart rate, it kind of sets a standard. Because obviously if you take, their heart rate and blood pressure, from a testing perspective, seat it, and then they're having to do it standing, well, that's obviously going to affect what you do. So you want to take it in the same posture they're going to be in during the exercise test, just before they go to do it. They should be familiarized with the mode of exercise that they're going to use for that test. So again, they should be aware of it, make sure they're comfortable on the equipment. And again, an adequate warm-up of at least 2 to 3 minutes should be completed before the exercise test starts. So continuing to look at our testing guidelines, again, every protocol should consist of approximately 3-minute exercise stages and then accompanied by an appropriate increments in work rate. So you'll look at that based upon the different tests that you utilize. You're going to want to measure your heart rate at a minimum of 2 times during each stage, near the end of the 2nd and 3rd minutes of each stage. So again, there's going to be some things that you're going to have to manage throughout your testing procedures here. And then your blood pressure should be measured during the last minute of each stage, so that you're just aware of any abnormal blood pressure response. So basically, this is just kind of like a safety measure. Again, as the person's work rate is increasing, their body should respond appropriately, and that's just to make sure, that's just to kind of make sure that the exercise is staying safe for the individual. In your other testing guidelines, your rating of perceived exertion should be taken near the end of the last minute of each stage using an appropriate scale. Again, ideally using the Borg scale, so you'll basically have a big Borg scale essentially printed out, ideally on the wall, or being able to show the person so they could visually rate their perceived exertion. Again, you want to monitor the client for signs and symptoms to terminate the test. We've already talked about those. So again, just some other examples, or kind of playing off the examples I gave earlier. If they attain approximately 70% of their heart rate reserved, or 85% of their age predicted max heart rate, that could be a sign to clinically terminate it. If the client fails to conform to the exercise protocol, if they request to stop the test, or any emergency situation, or any of the symptoms we talked about earlier, you would want to stop your testing. And again, following the test, categorize the client's endurance status utilizing an appropriate standard. Another thing you're going to want to look to do is also make sure that they do an appropriate cool down. And the intensity should be less than or equal to the first stage that they complete it within the test. And again, you're going to want to take your measurements, heart rate, blood pressure, and rating of perceived exertion, for at least a minimum of 5 minutes after the test, in the event that they've had any type of abnormal, if they've had an abnormal response, you're going to want to make sure that you have kind of a post-exercise test observation period, just to make sure that the individual is safe. So again, monitor them after the test for at least 5 minutes, a longer period of observation if for some reason it seems like they've had some sort of issue with the testing.